Bhakti, a completely unfair question, but it came up, I think, 3 times yesterday. What is your timeline of when Omicron ends? Is it weeks? Is it months? Is it all of 2020? What's your scope of the x-axis of Omicron?
Absolutely. So if you look at South Africa, I would have said 30 days. However, we've peaked much higher and our population is inherently different. So I'm really thinking months. I am not thinking that this is going to affect my summer plans. So I remain hopeful, right, that we're going to get past this peak soon.
So seriously, you think Omicron will be wiped away by the 4th of July?
Absolutely.
Why do you say absolutely? How do you get to that certitude?
So I think the fact is that when it peaks so quickly, we expect the fall to be just as significant. We're already seeing in New York and in Washington, D.C., that there is now a reduction in cases, which, it's very, very early, but it makes me hopeful. Plus, again, we're looking at South Africa and United Kingdom. So in United Kingdom, we've started seeing a taper. South Africa, from the first rise in the peak to the end, was around 30 days. So the viral transmission cycle here is smaller, which makes us more hopeful that this will end sooner.
As we are more hopeful that the pandemic will end more broadly and become endemic, we're left with a healthcare system that has been transformed. I'm struck by the number of employees who have left the profession, about the wage increases that they're demanding in order to stay there. How much does this healthcare sector look completely different than what we saw 2 years ago?
So I think the healthcare workforce is just one piece of this puzzle. The health system here in the United States is extremely complicated with what is the role of insurers, right? And how have they supported the COVID-19 response? Now we're also hearing that some insurers are going to start covering COVID tests, which I think is helpful, right, for future pandemics. But is that going to be the norm? And how will they step up in the future? And what is the power of the health system versus the state versus the individual hospitals in developing your surge preparedness plans? I think there is a lot of learning to be done. I think we're talking about a series of after-action reports. And hopefully there is a new way of us thinking about how does a health system support in a more unified, utilitarian manner.
What's the answer to getting people in the doors at hospitals at a time when we see massive numbers of vacancies that, frankly, a lot of health executives have said are unprecedented?
I don't think money is the only answer. It's very easy to say, we'll just pay you more, but you need to make this work environment kinder, right? Healthcare workers are also human beings. We have the same needs. So let's talk about what it means to be able to have children when you're a healthcare worker looking after patients who are infected. How do we manage sick leave? How do we give people time to recover? What psychosocial support services are available? So it's really not just more money. That is a stopgap measure. We need to look at the healthcare workforce as a whole and think, how does this become a place that people want to work? And how do we bring back the passion of medicine?
Doctor, can I just squeeze in a final question and go to the statement from Novak Djokovic, the tennis star, who tested positive with a PCR test. And the following day, on December 18th, he went to his tennis centre in Belgrade to fulfill a long-standing commitment for an interview and photo shoot. He felt obliged to go ahead and conduct the interview. He did ensure he was socially distanced and wore a mask, except from when his photograph was taken. Doctor, for someone in your industry right now, how do you react when you hear something like that?
I just think there's cognitive dissonance, right? They haven't seen the worst of the pandemic. The worst of the pandemic sits in ICUs behind closed doors. So, he treats it like a common cold. And that is why we are here where we are, right? Because of individuals that make decisions like that. I think my eyes roll over, to be honest. And I think, I hope you just don't come to the emergency department for a test.
Doctor.
And good luck.